Welcome. Welcome to the Avatar Home Health and Hospice Agency program. Today, we're going to discuss a very important topic that has to do with hospice, as we normally have done over the last few weeks. My name is Felix Cannibal. I'm one of the co-founders of the agency. We did that 20 years ago. So we've been around for a long time. We have served thousands and thousands of patients. And today I'm with Maya Arguez, our social media director. And she's going to help me with the program, which not as usual, I need all the help I can get.
Well,
So Maya, welcome.
thank you for having me. And yeah, as you said, we are going to talk about hospice, but we're also going to generalize it a little bit more and speak about basically any kind of home health, hospice, palliative care agency. So if you or someone you love is facing a hospital discharge, a tough diagnosis, or just trying to figure out how to keep a parent or loved one safe and comfortable at home, then
Right.
this is a really good episode to listen to. So we're going to focus on tips and red flags and green flags for choosing an agency. But
Right.
before we do that, do you want to tell them a little bit about Avatar and your experience?
Yes, of course. So as I said before, we've been in business for 21 years. We are not only licensed by the state of Texas, but we have certifications from Medicare, from Medicaid. We have the Joint Commission accreditation, which is one of the highest, if not the highest, accreditation an agency can get in the United States. Only 10% of the agencies in Texas has received the gold seal of approval like we have. During all this time, every time they come by and they do an inspection, which by the way, they don't announce it. They just come in and try to surprise you. Every time they've done that, throughout the years, we have received the gold seal of approval. We started with nothing, basically 2-3 employees and no patients. Today, we have 150 employees helping us take care of over 600 patients. And those patients are in the home health service, hospice service, palliative care, and provider services. So any type of service you might need at home, we can help you. And I think to keep it short, I'm going to leave it there. I'm sure that I will interject something of some of the qualities that we have as an agency as we go along. But I know that we have a long program today and not enough time to do it. So Maya, go ahead.
Yeah, so we'll definitely dive into some of those qualifications in a little bit. But do you want to tell them how long you've been in business and what areas we serve?
Yeah, so we've been in business 21 years, even though somehow we just announced that we celebrated 20 years. So we made a mistake there, but we've been in business for a long time. We service all of Houston and Harris County. In other words, Harris County, which is where Houston is, for those people who are not familiar with this area. And then the county just north of it is called Montgomery County. And that's where the city of Conroe is. But there, we have a lot of small cities surrounding Houston and Conroe. So wherever you are in these two counties and a little bit outside. So for instance, Sugar Land, we do have services in Sugar Land. We have services in Katy, in Rosenberg, Richmond, Cleveland up in the north, Magnolia up in the north. So there's areas that fall outside the Harris and Montgomery counties boundary lines that we still cover. So if you're within, if you are listening to this podcast and you have any questions, call me at 281-703-8050. And we'll be giving that number throughout the show. You can call me. I'll give you, even if you live in someplace else, I'll give you information that will be helpful to you.
Right, so let's jump into it. So we are going to talk about all the tips that we have for finding the right agency
Yes.
for your family. So let's say a family knows the type of care they need, whether it's palliative care, hospice, home health, whatever, and they're staring at a list of agencies. Maybe it's
Right.
from a hospital discharge planner or from a Google search. They need to narrow it down. And there's a few key categories we're going to talk about. So licensing and accreditation, availability, staff qualifications, reputation, and communication. So let's start with licensing.
Right.
What type of licensing should a recommended home health or hospice agency have?
Well, actually, if you are a legal agency in Texas, and that goes for any state, you need a license from the state. So for Avatar Home Health and Hospice, we have a license from the state of Texas. Then you have to apply to Medicare so you can actually see and get paid for seeing Medicare patients. And that is called a certification. So we've been certified by Medicare and we've been certified by Medicaid. So we can take care of patients that might not have Medicare, but they might have Medicaid. Now, when I say that, keep in mind that if you're not Medicare certified, you can only see patients that can pay cash. So those are very few between actually. So you do need that certification from Medicare. And then also some agencies like Avatar, not too many, but like we choose to be accredited by an outside agency, like the Joint Commission. And there's a couple of other agencies, but the Joint Commission is the oldest. What they do is they go into hospitals and rehab places and home health and hospice agency, and they come unannounced and they do a survey. They do an inspection. That inspection is going to last from 1 day to whenever they're done. In our case, because of the number of patients that we have and the different licenses that we have, they stay with us about a week. But you're talking about a week where they come in at 8:30 in the morning, they take over the office. You have to give them room, you have to give them the computers, all the passwords, all the patient charts, everything that we do in payroll. They're going to look at whatever they want to look. They have carte blanche. So that is very important, that you see that an agency has gone through the trouble of getting an outside accreditation besides the Medicare certification. I think that says a lot for the agency. So what else do you ask me about?
Right. So between the two being certified by the state of Texas and Medicare, those are legal requirements.
Right, you have to.
Something like the Joint Commission is not legally required, but it can set agencies apart.
Yes.
So how many agencies typically have that kind of accreditation?
Well, as far as I know, last time we checked, less than 10% of the agencies in Texas have received the gold seal of approval from the Joint Commission. So that gives you an idea that, so you're looking at, number one, the licensing. They have to have licensing, otherwise they're illegal. Number two, you want to make sure that if they have an accreditation, you want to know about it. And then number three, of course, that this is not necessarily in the order of importance, but if you have and we were there, we were at the time we had 6 months in business. So of course, if a patient was considered on us or a family, and they saw that we were in 6 months in business versus a company that's been in business for 20 years, so you cannot blame the family for going with the company with more experience and maybe more referrals and more of a track where you can say, hey, these people, like in our case, you can look at Avatar Home Health and Hospice you can Google it, and then you're going to see that we have 4.5 stars and we have like 180 reviews. You might look at other agencies and they might have 5 stars, but they might have 3 reviews. So that all of those things are important. Uh, so those are very, very important things, and that's where I will begin with. I will begin with, let me see what their past patients say about them, and then I will go from there.
Right. And there are, as you said, there are other accreditations like the Joint Commission. That's not the only one. So if they have other ones, that's also a good thing. But most agencies will have just one additional accreditation.
Right. Yeah.
So what about availability? How can a family know if an agency will actually be there when they need them? Let's say it's 2 a.m. or 5 p.m. or
Well, that depends on the service, right? Because and that comes with the education that you get. So one of the myths about home health is that a 24-hour service, which is not. So home health is an intermittent service. This is Medicare. I'm paraphrasing Medicare. It's an intermittent service that can be provided with someone who has the medical necessity and is homebound. And I can expand on that later if we have the time. So those two qualifications have to be there. Not everybody can get home health. And there's a lot of people that need home health, believe me, but not everybody qualifies, because you might need home health, but you're working. So you can ambulate from your home to your work and back. So that will disqualify you from being homebound. So, but I don't want to get into like all the technicalities and all the little details. But what you want to know is this. Number one is what kind of coverage you have in my area. So for instance, let's say you live in zip code 77380, right? And you want to ask the agency, do you have enough nurses and therapists and home health aides to take care of my loved one in my address, around where I live? That's where you want to find out, because an agency like ours, like I said before, we cover a large territory. But let's say that we have real good staff to cover the south of Houston, but not the north of Houston. You need to know that. Now, in our case, we're very blessed because we work very, very hard to train our nurses and our therapists and our home health aides, and we treat them really well to make sure that they stay with us, so we can cover a very vast territory with the staff we have. So, but you want to know that, and the agency, of course, they need business, and they're going to say, oh yes, for sure. So you can be more specific. You can ask them, how many times a week can a nurse visit me? How many times a week is a home health aide going to visit me? Do you have therapists? You have physical therapists, occupational therapists, speech therapists. Now, those are things that will be specified in the order that is going to come to the agency in case you choose that agency. So, but you want to know those things. Maybe not as specific as I'm saying it, but you have to have a good idea that these people, the agency you're choosing, is going to have enough personnel to take care of you. Now, the one thing that is important is, like you said, when you're in the hospital and you're about to be in discharge, a lot of the hospitals do not want to recommend a particular agency, because that, in a way, that's kind of illegal, or at least non-ethical. So they're going to present you with a list of agencies that work with your insurance company. And then let's say they give you 10, and you look at it and listen, who's been looking for a home health agency? Hardly anybody until you need it, right? So they give you a list, and how do you pick it? Because you like one name better than the other one, or so you want to get some information on them. You might say, hey, give me an hour. I'll let you know which one I want, right? Take your time and call the agency if you want to. And then you can have a better idea of whether you should go with that agency or not. And then now remember that you can choose any agency you want, even if they're not on your list. So let's say that after you listen to our podcast, you say, oh my God, if I ever need an agency, I want to be with Avatar, right? So that's fine. Whenever you go to your doctor or a rehab or a hospital and they say, we're gonna send a referral to a home health agency, you can say, well, wait a minute, send it to Avatar Home Health and Hospice. And they have to do it. By law, the patient can choose his or her provider. So you can choose Avatar. And I recommend you do, because we're really good.
Right, and if that patient is on hospice, they can also double check that there's a nurse on call 24/7. And also just the availability of, for example, at Avatar, when they get admitted, they're going to have your cell phone, the director of nursing's number, the office number, their nurse's number. So just making sure that those people are available to them within that agency.
So for instance, in home health, really is not a 24/7 service. However, when it comes to hospice, it's not that hospice is a 24/7 service. So in other words, the hospice agency doesn't have somebody at the patient's home 24 hours a day, but there's a nurse available 24/7. So if you are in hospice, let's say with us, with Avatar, or one of your loved ones is with Avatar, and you call and you say, hey, I want to talk to a nurse, that will put a nurse over there on the phone with you. If you say, I need a nurse to come and look at my husband or my wife, whatever, we'll have a nurse get in her car and go visit you. That is whether you call us at 5 o'clock in the morning, 2 o'clock in the afternoon, or Saturday, 1 a.m. It doesn't matter. We provide you with a nurse 24/7. And we also provide you with a CNA and a nurse's assistant and so on. So we have a very comprehensive hospice plan. But yeah, you have to have the conversation. For instance, ask them, how many times are you send the home health aide to my house a week? A lot of agencies are going to say 2 or 3 times, but very few agencies are going to commit more than that. And for instance, our commitment is we're going to send you the home health aide to your house 3 times a week. That's the minimum. But in some cases, we send them 5 times a week. Sometimes we send them 7 times a week. That very few agencies do that. So if you were going to ask that question, 100% of the time you will call Avatar and say, I want you to be our agency, because no other agency will do that. Now, another thing, I'm sorry, I forgot to turn off my phone, which is something that I shouldn't do, that I should do, but I shouldn't forget to do it, right? So give me a minute. I got all kinds of things going on here. So, so now that I'm doing this, sorry, my apologies. So where was I?
Well, let's move on. You pretty much answered that question. So let's move on to staff qualifications, because obviously you have a lot of skilled staff.
Yes.
But what can differentiate one agency to another when it comes to staffing, nurses, things like that?
Yeah. So obviously all the nurses need to be licensed by the state where they're practicing. And most of the nurses that are practicing today are registered nurses, even though there's some LVNs or LPNs, as it's called, licensed vocational nurses or licensed practical nurses, that are very good nurses. You don't have to be afraid of them because they work on the supervision of a nurse. of a registered nurse. So we have a training program. Now that's going to be a little bit more difficult for the patient to find out.
Right.
Because if you call an agency and say, hey, you have good nurses, they're going to say, oh yeah, our nurses are great. And that really goes into what kind of training these nurses have, because they all have to have prior experience before they come to a home health agency. Now, we have a program where we train nurses that come out of school, and once they get the license, they come and we train them from the get-go. And those are actually some of our best nurses. Why? Because they never learn any bad habits. So when they come to us, they come out with a clean slate, and we come in and we teach them exactly the way that we like them to do things. And you know, the proof is in the pudding. You know, like, you're going to have a nurse, and if you're not happy with them, you call the agency and say, you know, I want a different nurse. And in many cases, that one might be the only nurse available for that area, for that agency. See, so that's what it pays to be with an agency like Avatar. We have plenty of nurses and plenty of home health aides or nurses assistant, plenty of therapists. So if you call me and say, look, I don't like this nurse, I'm not going to ask you why. I want to send you a new one. And then after I send you the new one, I will call you back and say, so what's going on with, you know, Josephine? Because she's a very good nurse, and everybody's very happy with her. What happened there? And sometimes it's just a matter of the chemistry between the patient and the family and the nurse. Or the nurse says something that the family doesn't like, and, you know, then they go, oh my God, I don't want this nurse. But that hardly ever happens with us. Mm-hmm. Another thing that, before I forget, Maya, because you know that okay. I forget a lot of stuff. So another thing that is very important is, as the agency, let me have, actually, if you start with this, you will only choose Avatar, I can tell you. If you ask, let me have the name and number of your owner or one of your principals, you're not going to get it. I can almost guarantee you that. There might be another agency out there. But even though we have over 600 patients in service, every single one of those families have the two owners' cell phone numbers. My cell phone and the director of nursing, who happens to be my partner. She's also my daughter, because this is a family business. And we give out our cell phones. And these people, I got people, and I invite them to call me at any time. Now, most patients don't want to call me at 2 o'clock in the morning, even though I sleep with the phone next to me. So if somebody calls me at 2 o'clock in the morning, I'm going to answer. Unfortunately, sometimes I get a phone call from some drunk that missed out the number. I go, hello, and then that's a joke. That hardly ever happens. But you know, so say that. That's a good exercise. And you're going to find that no agency is going to be able to do that.
So next, we have a list of questions that people can ask when they're talking to someone from the agency. So I'm going to share the question, and then you can tell them kind of what answers to look for. So first being, what's the process for the first visit? How quickly does care start? Yeah. So Medicare wants you to start the services within 48 hours of getting the referral. Now, we're going to start the services as soon as the patient allows to start the service. So if we get the referral in the morning and we can send the nurse out in the afternoon, we're going to do that. If we get the referral in the afternoon, we're going to send the referral in the morning. Now, in our case, it all depends on the patient, because we're going to be so ready that people don't believe it. People are expecting, 1 or 2 days. We go right at it. So yeah, the agencies, you want to be admitted at least, I would say 24 hours should be plenty of time for an agency to admit you. Right. And then the following question being asking about staffing continuity and continuity of care. Yeah, that is very important. Continuity of nurses is you want to make sure
that you're going to get the same nurse, the same people in your home all the time. You don't want to be getting nurse Josephine today, and then Joanna, and then Maria, and then whoever. You want to make sure, because you're going to build that relationship, and they're going to know you. They need to get to know the patient and the family and the environment and under what circumstances that patient lives. So they have to do that in order for us to fully service that patient. Because there's other services that we can get for the patient that if you don't know exactly all the conditions of the patient, you might not be able to do it. So you want the same personnel there every visit, with some exceptions. Of course, somebody gets sick or something like that. Yeah, but you want the same personnel every visit. And also the continuity of care. Suppose that your patient, your loved one is in home health, but then you get the news from the doctor that, you know, your husband or your wife will be better served if they go into hospice services or palliative care services, or you need a caretaker. Now you're going to have to go and find another agency to do that second service. With us, you stay within the same umbrella and under the same personnel, which is very important. So you have the same nurse, the same CNA, nurse's assistant, the same caretaker or provider, whether you're in home health, hospice, palliative care, or if you're in the caretaker's department, obviously, you get no nursing because you don't need any nursing. So that is very important. And very few agencies are licensed in all those disciplines that I mentioned: home health, hospice, palliative care, and caretaker services.
Right. And then the next question they can ask is about cost and coverage. So what is your advice when it comes to what to look for in those answers?
Yeah, well, it's going to start with what insurance do you have? Because they should tell you from the get-go. The agency should tell you from the get-go. Let's say you have Blue Cross Blue Shield, right? And actually, that should be your first question to the agency. Do you accept, are you in network with Blue Cross Blue Shield? If they say no, go on to the next agency until you find one that is in network. Now, if you have traditional Medicare, you don't have to worry. It's called traditional Medicare of original Medicare. That means that you did not sign up with an Advantage plan or an HMO. That means that the agency is going to be dealing directly with Medicare. There's nobody in the middle, which that, if you could afford that, that's the best way to go. You get a supplemental plan to pay for what Medicare doesn't pay, and then you have the best coverage in the world. But yeah, the number one thing should be is your agency in network with our insurance company?
And then specifically to hospice, another question they can ask about is equipment, medications, and supplies. So what are some answers to look for there?
Yeah. So in hospice, the agency is going to provide you all the medical equipment you need. Like, for instance, a bedside, a hospital bed, a bedside table, bedside commode, a wheelchair, a walker, oxygen, a Hoyer lift, whatever medical equipment you need. A special mattress, by the way, which is the one we use, so our patients don't develop sores. So all of those should be provided by the agency at no cost to you. If they charge you something, you can call me, and then together we can call the police because they're not supposed to charge you anything. As far as the medical supplies, you're looking at diapers, wipes, gloves, lotions, and any other medical supply you might need. They're also included, no cost, no co-payments, no deductibles. And then the medications that are appropriate for hospice, no deductible, no copay. All of those things are provided by the agency. Now, Medicare is going to reimburse us for those expenses, but they're not going to come out of your pocket no matter what. If Medicare doesn't pay us because we made a mistake, you have nothing to worry about. We cannot bill you. One thing and the same applies, almost the same applies for home health. In home health, if you're over 65, you should not pay anything to the home health agency for the services. Now, in home health, the medical equipment, medical supplies, and medications, that is not included in the home health, but those are included in hospice.
Right. So as we wrap up, is there any kind of red flags or like weird answers that you would tell them to be cautious about when it comes to picking an agency?
Well, I mean, if the agency, you can look into maybe APS reports or Medicare complaints against the agency, that sort of thing. But yeah, you could look into that. But I don't know how public those records are. But I think if you go into Medicare.gov and you ask, has Avatar ever been, reported to for something? They will tell you, I think, because they cannot hide it from you.
All right. So then as we wrap up, is there any last things you kind of want to add, talk about when it comes to picking the right agency?
Well, actually, no, we have covered a lot of terrain today. But remember, our number is 281-703-8050. You want to have a company with longevity in the business. You have a company that offers you continuity of care. In other words, this is hard to find, but somebody that offers you home health, hospice, palliative care, and caretaker services, if you can find it. Somebody that has a good reviews in Google or other mediums. Those are things that are easy to find. And then, of course, you get into the specific questions that we went over. Are you in network with my insurance company? And can you really take care of me in my zip code, or give them the address? I say, do you really have good personnel in this area? So those are the main questions to ask.
All right. Well, that kind of wraps up for today. So we'll definitely be back next week with some more home health, hospice, provider service content.
Right.
If you guys want to learn more, you can visit us at our website, avatarhomehealth.com. You can also find us on social media at Avatar Home Health and Hospice. And if you want to give them your phone number one more time.
281-703-8050. And I want to kind of apologize because, I'm kind of clumsy and stuff like that. And I forget to turn off my phone. But that is because I answer my phone 24 hours a day. As soon as we finish with the podcast, I'm going to call that person back. So that's the kind of service and commitment you get from Avatar Home Health and Hospice. And God bless you, and we'll see you next time.
Estas son las redes sociales oficiales de Aliento Radio: Facebook, Instagram, TikTok, LinkedIn, Twitter y YouTube. Encuéntranos como @Aliento Radio Oficial. Aliento Radio Oficial.